Another ban went into effect in Missouri today, this one on gender-affirming care for minors and adults on Medicaid. A court ruling Friday said the state can implement the ban while the lawsuit continues. Now trans advocacy groups are taking their stories public. Our political editor, Mark Maxwell, is here with new details on their push. Mark.
Mike, trans care for teens has attracted so much attention in political circles. Advocates are hoping to hit something of a reset button and reframe the conversation in medical, academic, and personal terms, centering around their own lived experiences.
As Missouri's ban on gender-affirming care for minors goes into effect,
I came out as trans about 3 years ago.
People in the trans community are speaking out.
Queer people have always said, visibility is really, really important for us.
Avi Ivaturi fields hotline phone calls from queer and trans people in distress.
There's all this legal jargon going around. What does this mean for me? We can help figure out what that does mean.
Avi says those calls are coming in at a higher rate these days.
Obviously, this is alarming news and really overwhelming and frustrating.
In part because trans people wonder what the changes in the law might mean for their place in public life.
When I was younger, looking up, I didn't see people like me in society and successful.
Doctors helped Arrow Royston undergo gender transition procedures at 22.
We need to come out. We need to tell our stories. We need to see people like us thriving.
Now he manages workers at a Fortune 500 company and advocates for change in the community. He feels the supercharged political debate around gender-affirming care for minors misunderstands key points in the medical process.
If you don't transition before puberty, it can have impacts on your ability to blend in with society. And that's why it's really important, because that takes a huge toll on people's mental health.
That's why Promo, Missouri is calling on trans people to speak up and tell their stories to break through barriers.
I just want to live my life and go walk around and not have people like, oh, who is that? What are they doing? I can live my life authentically. I mind my business, which is what most people should do, and go about my day.
His message for trans teens impacted by Missouri's ban:
you have a place in this society, you can be successful, you can be here, and we want you here.
And just moments ago, Missouri Attorney General Andrew Bailey's office sent us a copy of a cease and desist letter he sent to doctors in St. Louis and Kansas City, telling them they can no longer prescribe puberty blockers or cross-sex hormones to any new minor patients. Minors already undergoing that care can continue, but cannot receive any gender reassignment surgery operations, which is already highly uncommon and rare for minors.